Senate Committee on Health, Education, Labor, and Pensions will come to order. And we're delighted to welcome our panelists who we're going to hear from in a few minutes. But let me begin by telling everybody what they already know, and that is, it is no great secret that in America today we have a mental health crisis, and that crisis has been exacerbated by the horrific COVID pandemic which we have experienced. And this is a crisis that has hit all of us, but I think especially the younger generation. In America today, 40% of parents report being either very or extremely worried that their child is struggling with anxiety or depression. According to a recent survey by the Centers for Disease Control, nearly 1 out of every 3 teenagers in America reported that the state of their mental health was poor. 2 out of every 5 teenagers felt persistently sad or hopeless. And tragically, 1 out of every 5 teenagers in our country have seriously considered suicide. How frightening is that? Tragically, suicide was the second leading cause of death for young people between the ages of 10 and 14, and it was the third leading cause of death among teenagers. All of us understand that the pandemic has had a huge and lasting impact on the mental health and well-being of our country and our young people. Let us never forget, and sometimes it's easy to forget, we remember the 1 million people who died during the pandemic, but over 200,000 children, often children of color, by the way, lost one or both of their parents to COVID. And think about the impact that that's had on their lives. Further, and I think we're going to hear more about this later, our kids have become less connected humanly to each other. And this is kind of a new phenomenon. And Dr. Murthy has written about this, and I'm sure we'll be speaking about it this morning. Instead of building trusting, healthy, and strong relationships with their friends, their teachers, their mentors, an increasing number of our kids are turning to their phones and social media to feel connected. And what type of impact does social media have on the mental health of our nation's youth? That's an issue that we have got to really explore at great length as a nation. According to a recent study, 32% of teen girls said that when they felt bad about their bodies, Instagram made them feel worse. More than 40% of Instagram users who reported feeling unattractive said the feeling began on Instagram. About 25% of teenagers who reported feeling not good enough, inadequate, said it started on Instagram, but we're not here to single out Instagram alone, certainly. And I'm sure that the same can be said about other social media platforms. And let's be clear, and something I think this committee in months ahead will get into. We are up against some of the best minds in the world who keep coming up with new ways to get teenagers addicted to their websites in order to sell them more products and make more money. And that's what we are going to have to address. But it's not just social media, as dangerous as that may be. Kids in Vermont, and I've been around to a lot of high schools, some community colleges in my state, but around this country as well, worry about the kind of future that awaits them. They wonder if their political leaders in this country and around the world will address climate change, or whether the world that they and their kids will grow up in will be increasingly unhealthy and uninhabitable. And I really do wonder, walking here today through the smog and the smoke that Washington, D.C. is experiencing right now, the horror in New York City. Yeah, it's a bad day, but you wonder what impact it has on the kids who wonder, is this the future for me? And what that does to them psychologically. Yesterday, on another issue, I had the occasion to meet with people who came to the Capitol who lost loved ones as a result of gun violence in schools. And I was stunned in Vermont, where kids worry. You know, when we were young, you went to school, it was a safe haven. Now they really wonder that some terrible thing might happen. And when we talk about the anxieties facing young people, we can't ignore economics. Everything being equal, if we don't get our act together, the young people will have a lower standard of living than their parents. And right now, some 60% of our people are struggling paycheck to paycheck. So all I would say is the pandemic has exacerbated a bad situation. It is there. As political leaders in this country, it's our job to address it. Senator Cassidy, the mic is yours.
Thank you, Mr. Chairman. Everybody here knows a fellow American struggling with mental health issues. Everybody watching knows. School closures, isolation from the COVID-19 pandemic exacerbated, almost concentrated this among those who are younger. According to CDC, from 2021 to 2022, the percent of teenagers feeling sad or hopeless increased from 37% to 42%. Those seriously considering suicide goes from 19% to 22%. To say it's troubling is to kind of not have an adequate adjective. This is terrible. The goal of this hearing is how do we improve access to quality mental health care for young people. Now, we must highlight that Congress has done a lot in recent years to improve mental health care and access for children and all Americans. We have walked this ground. We need to see what our recent work has accomplished, need to measure its effectiveness, and then to figure out what gaps remain. Now, just for context, we know this. For decades, the nation's mental health system was dysfunctional, under-resourced, not getting crucial services to Americans facing mental health issues, especially those in underserved areas. I worked in a hospital for the uninsured and the underinsured for 25 years. I worked with this. Now, before I go on, let me give a shout out to Senator Chris Murphy. He and I, in 2015, led the Mental Health Reform Act, an historic bill that overhauled our mental health system to increase access to quality mental health care for all Americans. And I remember Chris at that time saying, Bill, there are some things we agree on, a lot of them, and a few that we disagree. Let's focus on that which we agree and leave the other for another day. And by that, we did something which Lamar Alexander, then the chair of this committee, said he didn't think two freshman senators could do. There's both an insult and a praise in there. But we accomplished it. And Lamar went on to say it was the most profound reform of mental health law in the previous 30 years. He and I were both honored. Now, we teamed up again this past year to reauthorize this and to reform it to better address the needs of Americans. We increased funding for mental health block grants to better serve children at risk for serious mental illness, expanded telemental health care and promoted the integration of mental health providers into primary care, increased mental health workforce programs, focusing on treating children in underserved populations, and I could go on. Now, additionally, and again, I'm going to give a shout out to Murphy once more, in response to the tragedy in Uvalde, Congress passed the Bipartisan Savers Community Act, which invested billions of dollars so that every child and every American had access to mental health care, no matter whether they are in a pediatrician's office, their school, an emergency room, or a community health center. Chris was the lead on that. I had the privilege to work with him, but Congress passed it. The legislation invested $8.6 billion to expand certified community behavioral health clinics to all 50 states, offering 24/7 crisis intervention services, outpatient mental health, and substance abuse services, case management, increasing access to primary care for Americans, especially those who are lower income and uninsured. It provided $2 billion for school-based mental health treatment, to train school personnel to better help students through a crisis, to increase care for children suffering from trauma, to fund prevention programs, to decrease bullying and violence at schools, and much more. Additionally, the Safer Communities Act instructed the Department of Education and the Department of Health and Human Services, both represented here today, to improve guidance to schools, particularly those in small or rural communities, to more easily bill Medicaid for school-based mental health services. And we will talk and hear more about that during the first panel. I'm proud of the work that Congress put into this legislation and signed into law, and these achievements show that there's a strong bipartisan support for addressing youth mental health issues. But, and I say this all the time at home, these grants and programs only make a difference if state and local government are aware of them and apply and show local leadership in order to participate. We need this local leadership to use these resources to make sure the assistance reaches those who need it most. What we can't do is pretend that Congress hasn't done anything and that we must start anew. That, sweeping the deck clean, so to speak, in our minds, not acknowledging the base upon which we build, will create duplicate, inefficient programs, wasting dollars and wasting effort. By the way, the chair, just echoing the chair, made the point, and I agree wholeheartedly, as you might guess, that the resources Congress appropriates should not be wasted. Now, Congress can't solve this on its own. Throwing money at an issue without accountability is not the solution. There has to be complete buy-in from the executive, from states, local government, tribal leaders, and community organizations, among others, to make sure these programs work as Congress intended. There is, however, existing legislation up for reauthorization that requires attention. As I mentioned in last week's hearing, the committee has 9 healthcare reauthorizations awaiting for programs that expire in September. One of these is the Support Act, which helps individuals dealing with substance abuse disorder and increases support services for children suffering from trauma. There are more than 50 individual provisions in the Support Act that fall in this committee's jurisdiction. The fact that the committee has 2 months left to reauthorize the programs and we have not formally considered bipartisan text, let alone marked them up, is concerning. I reiterate that reauthorizing the Support Act and these 8 other health-related bills on time, bipartisan, must be the committee's top priority. As ranking member of the committee, improving our federal programs so they're more effective and having greater reach is crucial. So let me finish by saying I look forward to hearing from our witnesses as to how we can better address the mental health crisis to make sure that more young people have access to quality mental health and that the resources already allocated are used effectively. Thank you. I yield.
Thank you, Senator Cassidy. Now we're going to hear from our witnesses, and our first witness will be Vice Admiral Vivek Murthy, who is the Surgeon General of the United States of America. In my view, Dr. Vivek has done an extraordinary job in talking about the mental health crisis and the crisis of loneliness and many, many other issues. Dr. Vivek, thanks very much for being with us. Dr. Murthy.
Thank you so much, Chairman Sanders, and thank you so much, Ranking Member Cassidy, for your leadership as well on issues related to mental health. To all the members of the committee who are here today, I'm Dr. Vivek Murthy. I have the privilege of serving as Surgeon General and as Vice Admiral of the U.S. Public Health Service Commission Corps, but I'm most importantly here as a father of 2 young children who is concerned about their future and the future of kids across America. And I'm here to speak about what I believe is the defining public health issue of our time, and that is the youth mental health crisis. It now threatens the foundation for health and well-being for millions of our children. In 2021, more than 2 in 5 high school students, including almost 60% of girls and 70% of LGBTQ youth, reported feeling persistently sad or hopeless. Nearly 1 in 5 high school students reported making a suicide plan, and this followed a 57% increase in the suicide rate among young people in the decade prior to the pandemic. In response to this crisis, in December 2021, I issued a Surgeon General's advisory on protecting youth mental health. And I did this to call our nation's attention to this urgent issue and to the need to act. Over the last 2 years, I am grateful that Congress on a bipartisan basis and the Biden administration have made unprecedented investments to strengthen the mental health care system and to connect more youth to care. And these investments have already started to help children and families. But as all of you know, we have much more to do. Last month, my office released 2 new Surgeon General's advisories, one on our epidemic of loneliness and isolation, and the other on social media and youth mental health. Together, they explore 2 important drivers of the youth mental health crisis. Regarding loneliness and isolation, we now understand that social disconnection is both exceedingly common and profoundly consequential. About 1 in 2 adults are reporting measurable levels of loneliness, and social disconnection is associated with an increased risk of not only depression, anxiety, and suicide, but also heart disease, dementia, stroke, and premature death. The loneliness epidemic has hit young people particularly hard, and they have the highest rates of loneliness across age groups. The time young people ages 15 through 24 spend in person with friends declined by more than 50% from 2003 to 2019. Furthermore, there's been a decline in participation over the last half century in community organizations that have traditionally brought us together, including faith organizations and recreational leagues. Second, though, I'm increasingly concerned about the harmful impact that social media is having on youth mental health. Despite near universal use, there's inadequate evidence to conclude that social media is sufficiently safe for our kids. And while social media may provide some benefits for some children, there's a growing body of research associating social media use with potential harms. This is especially concerning during adolescence, which is a highly sensitive period of brain development for kids and when they're particularly susceptible to peer comparison. Now, the data show that youth who spend more than 3 hours a day on social media face double the risk of experiencing symptoms of depression and anxiety. This is deeply worrisome because on average, teenagers are spending 3.5 hours a day on social media. And excessive social media use can also disrupt activities that are essential for healthy development, like physical activity, sleep, and in-person interactions. For example, a third of adolescents are telling us that they stay up until midnight or later on weeknights in front of their screens, and much of that is, in fact, social media use. In addition, too often kids on social media are exposed to extreme, inappropriate, and harmful content. Indeed, nearly half of adolescents are saying that social media now makes them feel worse about their bodies. Now, two other drivers of youth mental health crisis that I just want to note briefly. One is trauma, which has become all too common in young people's lives, particularly from violence and abuse and the loss of loved ones to incarceration, addiction, and death. When young people go through such adverse childhood experiences, we know it has a negative impact on their mental and physical health. Additionally, for many young people, their confidence in the future has been undermined by the serious challenges they are set to inherit, from economic inequality and climate change to racism and gun violence. This is what they say to me time and time again when I meet with young people around the country. The bottom line is our kids can't afford to wait longer for us to address the youth mental health crisis. We have to expand our efforts to ensure every child has access to high-quality, affordable, culturally competent mental health care. But we also must tackle the root causes by addressing the potential harms of social media through age-appropriate health and safety standards and data transparency requirements, by investing in school-based programs that equip children with the tools to manage their emotions, adversity, and their mental health, by addressing trauma, particularly violence, and by embarking on a generational effort to rebuild social connection and community in America. Finally, we can all play a role in addressing the ongoing shame and stigma that still surround mental health and prevent young people from asking for help. Now, our obligation finally to act is not just medical, it is moral. It's about fulfilling our most sacred responsibility to care for our children and to secure a better future for them. I thank you for giving this critical issue the attention and the action it deserves, and I'll look forward to your questions.
Let me turn to Senator Cassidy, who will introduce our next witness.
It is an honor to introduce Mrs. Catherine Neese, Deputy Assistant Secretary of the Office of Special Education and Rehabilitative Services at the U.S. Department of Education. In her role, Mrs. Neese works to improve the educational and employment outcomes for students with disabilities. Today, she'll discuss the department's broader work to support the mental well-being of all students. Mrs. Neese.
Chairman Sanders, Ranking Member Cassidy, and distinguished members of the committee, thank you for the opportunity to share the Department of Education's work on youth mental health and promising interventions. The Youth Risks Behavioral Survey, released this past February by the Centers for Disease Control and Prevention, conveyed alarming findings of the prevalence of mental health or substance use disorder among our nation's youth. The report advances the critical need for schools to expand school-based services and to connect youth and families to community-based sources of care. Simply put, schools are a gateway to needed services that otherwise might be inaccessible to many young people. The report also emphasizes the responsibility of schools to ensure that all learning occurs in safe and supportive environments. The department's work is focused on three top priorities: increasing the skill and knowledge of existing school personnel to support the mental health needs of students, increasing the supply of mental health professionals who can work with students, and increasing funding through the Medicaid program to support school health services, including mental health services. 1 year ago, Congress provided new funding under the Bipartisan Safer Communities Act that significantly bolstered federal, state, and local efforts to address student mental health needs. I'm pleased to provide you with an update of our work to implement this law. Last September, the department awarded $1 billion to state educational agencies to competitively award subgrants to high-need school districts for activities to support safe and healthy students. This Stronger Connections grant program will support school districts to develop, implement, and evaluate comprehensive programs and activities that foster safe, healthy, supportive, and drug-free environments that support student academic achievement. The Bipartisan Safer Communities Act also provided $1 billion over 5 years to be equally divided across 2 programs to increase the supply of school-based mental health service providers. The response to these 2 grants has been enthusiastic. Under the School-Based Mental Health Services Grant, 12 states in the District of Columbia and 229 school districts across 41 states submitted applications. The department was able to fund 9 states, the District of Columbia, and 94 school districts across 31 states. Under the Mental Health Services Professional Demonstration Grant Program, 266 school districts applied, and the department was able to fund 160 grants. To support this $280 million of federal support across 264 grantees that will train 14,000 school-based mental health professionals, the department will fund a mental health personnel technical assistance center later this year. This past January, the department awarded $86 million in grants to local communities through the Promised Neighborhood and the Full Service Community Schools programs. The Bipartisan Safer Communities Act also directed the Departments of Health and Human Services, in collaboration with the Department of Education, to issue guidance to increase access to school-based health services to children enrolled in Medicaid and the Children's Health Insurance Program. This guidance was released on May 18th of this year. Medicaid and CHIP provide health coverage to more than half of America's children, roughly 41 million children. These programs are administered by state according to federal requirements. Children are eligible based on family income or unique health care needs, such as having a disability or a serious mental illness, or if they are in foster care. Under Medicaid's Early Periodic Screening, Diagnostics, and Treatment Program, eligible children can receive comprehensive primary health, mental health, and behavioral health services. Medicaid-enrolled children who need services in school can fall into 2 categories: eligible children who need general health care services, and students with disabilities who receive services under the Individuals with Disabilities Education Act. In 2021, schools received nearly $6 billion in total payments for school-based health care to Medicaid students. Schools also received about $14 billion in federal IDEA funding. In 2014, the Centers for Medicare and Medicaid Services issued a letter to state Medicaid directors clarifying reimbursable services in a school-based setting. The CMS letter explained that schools can seek payment for all Medicare-covered services provided to all students enrolled in Medicaid, not just for students with disabilities. As of May 2023, 21 states have used this policy to expand their school-based Medicaid programs. Most states use these funds to hire and sustain essential personnel who can deliver or facilitate the delivery of health and mental health services. As you can see, the department is actively engaging in efforts to address the mental health crisis facing our nation's youth. We're committed to ensuring that students' needs are met, that they are ready to learn, and that they have the full access to learning opportunities. Thank you for the opportunity to be here, and I look forward to answering your questions.
Mrs. Neese, thank you very much. Let me start off with Dr. Murthy. Senator Cassidy mentioned what is true is that the Congress has taken some action, but I will tell you, as I go around Vermont and talk to teachers and principals, they tell me they need more help. In your judgment, do we have at this moment the kind of mental health infrastructure from psychiatrists to social workers to counselors that this country needs.
Well, thank you, Senator. And I do appreciate the significant historic investments that have been made over the last few years. I think they have helped, but we do need more to help build the infrastructure. When we think about care, for example, mental health care, there are several pieces of the infrastructure that still need to be expanded. Number one is the mental health workforce itself. And I'm talking here not only about psychologists and psychiatrists and others in the traditional mental health delivery model, but I'm also thinking about peer support models and others which we know can help kids, and we need to think more broadly about that workforce.
Let me ask you this. We've talked a lot about the problems. Talk about some of the solutions. Are there communities or schools in America that are doing something that is effective in addressing the crisis we're talking about?
So that is the good news, is that there are successful models around the country. Many of them do not know about each other and hence are not learning from each other, and we have to invest in studying and scaling them. But a few that I'll mention, one is the Becoming a Man program, which has been a very powerful program, started in Chicago and now spread to some other cities, which has worked in high schools with helping young people essentially be sources of support to one another, and has been able to demonstrate actual benefits in trials that were run by the University of Chicago. We also know the After School Matters program has been another one which has brought community organizations together to be with kids and provide them mentorship, support, and safe spaces to play and learn after school. That has also demonstrated positive benefits.
Let me ask you this, because you've written about this. You write about loneliness. And yet people spend half their lives on these things. What is the difference, in your judgment, between human interactivity and activity on social media, and how does that impact the well-being of Americans?
Yeah, well, Senator, this has been an important point of concern for me. There is no substitute for in-person interaction. As human beings, we evolved over thousands of years to perceive not just the content of what someone says, but also interpret their body language, to sense nonverbal cues. We take all of that in, and that contributes to a rich human interaction. When you strip a lot of that away, you lose richness, you lose quality of connection. That's not to say there's never a place for texting or for online connection, but what I worry about is that the balance has shifted dramatically toward online connection and away from in-person connection, particularly for our kids. But the other concern, Senator, is not only what kids are missing out on as a result of social media, but what they're being exposed to on social media. And I talk to parents all over the country and to kids as well, who say that they're exposed to content that's violent and sexual in nature, that they're often bullied and harassed online. 6 out of 10 adolescent girls are telling us that they've been approached by strangers on social media in ways that have made them feel uncomfortable. So I'm concerned both about what is not happening as a result of social media in our kids' lives, but also about some of the toxic effects of what they're being exposed to.
Mrs. Neese, you spoke about the impact that Medicaid is having on providing services to kids who desperately need it. We are now, as a result of the end of the pandemic and the cessation of the funding, the many billions of dollars we put into funds and increasing Medicaid, what impact will hundreds of thousands of millions of people losing their Medicaid have on mental health in this country?
Senator, thank you for that question. The work that we've done with the Department of Health and Human Services to make it easier for schools to access the Medicaid program for school-based services is one that we're very proud of, because we think it's going to make it easier for schools to hire and sustain necessary people. At the same time, we've been working hand in glove with the department to get word out to our school leaders about this time of re-enrollment, and hoping that those children who have to re-enroll in Medicaid are found eligible, and that those that are found not eligible can be directed to another source of insurance. But it is something that I think the administration is very concerned about, and wanting to do everything we can to make sure that children who are eligible can stay on the program.
But is it a concern that if hundreds of thousands of millions of families lose their Medicaid, it's going to make it harder for people to get the mental health services they need?
Without question, sir.
Senator Cassidy?
Although I'm tempted not to, because my fellow Southerner did not wear a seersucker today, I'm going to defer to Senator Tuberville.
I've got 2 suits. I just forgot. Thank you, Mr. Chairman, for having this hearing. I spent 35 years with the youth of this country as a coach, educator, and this is not just a crisis that we have, mental health. It's an emergency. We got huge problems. This is probably the biggest problem we have in this country. It's getting worse every day. I saw it change in just a short period of time. The number one commodity that we have in this country is not gold and silver, it's our young people, and we're destroying them. And we're sitting back and watching it happen. I've seen prescription drugs take over our youth, especially a lot of the kids that I work with. You know, we've ruined the nuclear family, and that's where a lot of this has got to come from. I counted up yesterday 32 mental health programs that we have in this country. 32. We spend tens of billions of dollars. We're not making any progress. We're going the opposite way. We have all kind of addiction. I talked to a sheriff last week in Montgomery, Alabama, and he said, Coach, I'd never heard the word fentanyl till 2 years ago. Now that's 95% of the drugs that we have in our schools and on our streets. The biggest drug we got is this right here. We all got it. There's not a person in here that doesn't have one of these. I'm guilty like everybody else, and I stay on it, and I think everything on there is true, but it's not. But our young kids think that it is. That's the problem. And we got to get control of that. And a lot of it, that's what we're talking about here today, is loneliness. And we can agree on some of that. We have a program in Alabama that's called HERSHA that our state mental health department is running through our children's hospital. It works to connect interested primary providers with mental health specialists across the state and operates as sort of a command center out of the hospital in Birmingham. Kids experiencing all the issues that they have, they're connected with providers that are close to them, whether it's rural or inner city. Money for this particular program has tripled in the last year in a bipartisan Safer Communities Act. Now, I will tell you this, we can afford a lot of things around here, but we cannot not afford to fund mental health. We can't. We have to be able to afford it, and through situations like this. So, Dr. Murphy, are we tracking the successes and failures of the rest of the billions of dollars that we spend? Are we tracking that? Is it where it's working? Have you got people that's doing that in your line of work that's helping us track the money going, and is that money helping to the degree where we can see success?
Well, thanks, Senator, and I wish I could circle, underscore, star so much of what you just said, because you're right on, and you're right that the most important asset we have is our kids, and we've got to do more to protect them. I also agree with you that when we do put funds toward a cause, it's important to know, is it actually working? Is it delivering the benefit? And while our office, the Office of Surgeon General, does not conduct evaluation trials, that's not what we are a resource to do. We do have colleagues across the Department of Health and Human Services at NIH and at SAMHSA who do conduct evaluations of programs so that we understand what's working, who it's working for, and what's missing. But I think, Senator, to pick up on something else you said here as well, I think, and I like the program you mentioned in Alabama in terms of the concept of building a network and an infrastructure so that primary care doctors in particular and others aren't trying to manage all this on their own. Like programs like the Pediatric Mental Health Access Program, for example, have been very helpful in making sure that those primary care doctors can get expertise, mental health expertise, into the clinic when a patient is there. And we do need more programs like that. But I don't think that we will be able to keep up with the sheer disturbing trends that we're seeing in terms of increased mental health concerns unless we simultaneously attack some of these root causes. And you mentioned our devices, and in particular for young people, social media has become, I worry for too many of them, a contributor, an important contributor to their mental health strains. I also spend a lot of time with student athletes when I travel around the country. I do roundtables specifically with student athletes. And many of them tell me that, that not only are they having a hard time sometimes getting help, some of them have incredibly supportive coaches and administrations, others do not. I had one football player who told me that After having serious thoughts of taking his own life, he approached his coach and said, and it took a lot of courage for him, but he admitted to his coach what was going on and asked for help. But as a response from the coach was, well, you know, if that's how you're feeling, maybe this program's not for you. You should consider going to another university. And he was heartbroken. Now, thankfully, that's not the response that most kids get, but we still have more to do in terms of making sure kids get the help they need. But if we can focus on making social media safer for our kids, if we can focus on rebuilding the social connection and community that our kids need, families are a key part of that, faith institutions are a key part of that, other community organizations like YMCAs, Boys and Girls Clubs, these all play vital roles in helping connect kids to each other, families to each other, but participation in them, Senator, has been declining for half a century, and it's leaving people lonely, isolated, and at greater risk for mental illness.
Thank you. And one thing I'd like to say, I know we're over a little bit here, Mr. Chairman, but we have, unfortunately, people in this country that are born with a mental health problem, and we're trying to treat them with a lot of prescription drugs. And I think that's fine to a certain degree. Sometimes we're over-prescribing. But the problem is we're creating more mental health problems now than we have young people born with mental health problems. And I think we all have to understand that. And if we'll start understanding that, I think we can understand the problems that we have to overcome. Because if we don't do this, now we're going to lose the country that we all grew up in. Because mental health is the #1 problem in this country. #1 problem. And we have to, and because it leads to everything else. It leads to so many things in this country that are negative. So thank you for your answer. Thank you, Mr. Chairman.
Senator Casey.
Mr. Chairman, thanks for having this hearing. I want to thank you and the ranking member for convening us. And I want to thank both of our witnesses for their testimony and their public service. I wanted to start with Deputy Assistant Secretary Neese to talk about bullying and harassment, one aspect of this larger challenge. I think we can all agree that children deserve to go to school without any fear or intimidation, but as we know, far too often bullying and harassment affect so many children and can have very serious consequences for the mental health that stay with them for the rest of their lives, and it undermines their ability to achieve academically. We know that these issues are especially prevalent among students with disabilities, LGBTQ+ students, students of color, and students who are either in high school or elementary school, girls and young women. So to support the well-being of all students, I've introduced multiple times now the Safe Schools Improvement Act, which would require school districts to adopt codes of conduct that explicitly and transparently prohibit bullying and harassment based upon race, color, national origin, sex, disability, sexual orientation, gender identity, and religion, very much consistent with our civil rights statutes. The bill would ensure that school districts take proactive action to support the safety and inclusion of all children. Deputy Assistant Secretary, what's the value of universal prevention strategies such as legislation like I just outlined in supporting mental health and academic achievement of every student?
Senator, thank you for that question, and thank you for... Is that better? There we go. Sorry. Thank you for that question. I think the department has partnered with the Department of Health and Human Services on a website called stopbullying.gov, which includes resources for schools to do exactly what you're saying. I think one of the reasons we are so proud of the Bipartisan Safer Communities Act and the work we're doing to increase the supply of mental health professionals who are in school is to make those things real. It's important to have the culture of a school be conducive to learning and safe for everyone. And we want to have those resources in schools and available to schools so that they can actually act on it. So I couldn't agree with you more. The need for us to address the bullying, particularly of vulnerable kids, kids with disabilities, kids who may have uncertainty at home. We want school to be that safe place where they always know that there's somebody there who has their back.
Thank you. I wanted to move to a question for Dr. Murthy. One of the many pieces of data that you cite in your testimony, and I'm looking at page 1 of your written testimony, it just kind of leaps off the page, and I'm just reading in pertinent part here. In 2021, nearly 1 in 5 high school students reported making a suicide plan. Hard to comprehend those numbers. 1 in 5 high school students. And I wanted to not just focus on those high school years, but what happens afterwards as well. And because if that's the circumstance in high school, we can only imagine what that means down the road. This challenge that we were all talking about here today predated, obviously, the pandemic, but was made much worse by it. I'm citing here the Kaiser Family Foundation showing that half of young adults ages 18 to 24 reported anxiety and depression symptoms this year, 2023, half of young adults. Despite these rising needs, many institutions of higher education are poorly equipped to handle the mental health needs of students. I've introduced the Higher Education Mental Health Act along with Senator Kaine. The legislation promotes collaboration among educators, students, parents, advocates, and communities to study the mental health concerns facing children. How can institutions of higher education better support students who are struggling with mental health today?
Well, thank you, Senator, and I appreciate your leadership on this issue and with your proposed legislation. I think institutions of higher learning have a huge role to play. First of all, they're where a lot of young people are, and we've got to bring the care to where people are. They can help to change culture by starting conversation addressing stigma. They can increase access to mental health services on campus and through telehealth to make it easy for kids to get care. But they can also invest in building the kind of connection and community that we know is vital to the mental health of children. It doesn't just happen by throwing kids in a room and saying, hey, mingle and build connection. It turns out a little bit of structure, along with a little bit of time, can help kids actually build the relationships that they want. And finally, let's just keep in mind, many kids don't have what we might assume are just basic tools for managing emotions, building strong, healthy relationships. Many of them may not have gotten that. And so we've got to recognize that. And it's why I think programs that focus on building social skills and an emotional development so kids can manage their emotions and understand the emotions of others are really vital. That's a life skill that to me is just as important as learning how to read or write.
Thanks very much.
Senator Cassidy?
I defer to Senator Budd.
Thank you, Senator, and thank you, Chair, and thank you both for being here today. So I sent a letter to NIH back on May 9th asking why taxpayer dollars were spent on a study entitled Psychological Functioning in Transgender Youth After 2 Years on Hormones, in which 2 participants tragically committed suicide. So I'm still waiting for a response from NIH on that letter. And Chairman, I ask for unanimous consent that I can submit my letter for the record. Thank you. Now, the researchers, they concluded that the study was a success, but they admitted also that they couldn't show that cross-sex hormones improved the psychosocial functioning for minors. So clearly, it looks like this was a real waste of taxpayer dollars. Even worse than that, it led or contributed to the suicide of 2 youth. So, Dr. Murthy, considering what I understand is your past support for providing cross-sex hormones to children, can you explain whether you think spending more taxpayer dollars on research into transgender procedures on minors will actually help children with the mental issues that we're discussing today?
Well, thanks, Senator Budd, for that question. While I was not directly involved in this study and I'm not familiar with it, what I will say is that it is important for us to study what measures may help improve the mental health and well-being of transgender youth, because what we see clearly in the data is that as disturbing as these rates of anxiety, depression, and suicide are, they're actually disproportionately higher among LGBTQ and youth, particularly transgender youth. And studies that help look to understand what interventions work to address those psychosocial concerns, I do think are important because this is a community that is struggling.
Thank you. A follow-up to that, are you concerned about causing sterility and infertility in children who receive these cross-sex hormones, and about the negative long-term impacts of these medical interventions on their mental health?
Well, Senator, I think whenever you have a medical intervention, it is vital to study both the short and long-term impacts on physical and on mental health. And I think that's where an investment of resources is needed.
So just to clarify, you say you would be concerned about the long-term and short-term impacts of these medical interventions on their health, their mental health.
Well, I think it's important for us to understand what those are through research, sir. So that's what I'm saying. And I think that this is a space where this is obviously a very complex area, and what we do need to do here is what we do in other areas of medicine, which is to look to experts who have expertise in this area to put together the kind of guidelines that clinicians can then look at and then make the best decision for patients based on that individual circumstance, just like we do in other areas of medicine.
Thank you, and I would just hope that the medical community in their research would be very cautious here. I mean, we've seen an NIH study which contributed to the suicide of 2 individuals, so please be careful, is the message. I want to shift gears just a little bit back to social media. We know that children are being bombarded every day by unhealthy information on social media. Millions of children are suffering, as we've talked about, from anxiety and depression, loneliness, because of the addictive content on social media. There's an advisory, I think, that you issued on social media and youth mental health, and it discussed the increased use of social media by kids. So to what extent, Dr. Murthy, do you agree that social media is damaging to the mental well-being of children? How do you believe that we should address this?
Well, thanks for that, Senator. And my concern here is not just as Surgeon General, sir. It's as a doctor and as a parent. You know, I have a 5- and 6-year-old children, and my daughter is 5. She's in preschool, and she came home a couple of weeks ago and asked my wife and me if she could post a picture on social media. She doesn't even have a social media account. We've never talked to her about social media, yet all of her friends are talking about this. And I do believe that while there are some kids who get benefits from their use of social media in terms of opportunities to interact with others, in terms of the opportunity to find a community online, whereas they may not have one in person, I do worry that for many children, the effects are in fact harmful and are contributing to the depression and the anxiety that we see among many young people, as well as issues with body image. In terms of what we can do, I think there is a lot we can do. You know, ultimately, this isn't all about what government can do. I think there's an important role, a critical role for parents here and for kids themselves. But I think what parents need is some support and help. And by establishing safety standards for social media that help protect kids from exposure to harmful content and from harassment and bullying and from features that seek to manipulate them into excessive use, I do think that we can help parents. We also need, as policymakers, I think there's also a role to require data transparency here. And researchers around the country, Senator, tell me that they've had a hard time getting the data from companies to fully understand the extent of the impact of social media. I'll lastly just say this, Senator, when our children get old enough to drive a car, or when they're small, like mine were a few years ago, we had to get a car seat for them, we don't tell parents, you know what, go inspect the tires yourself, check out the engine, make sure the frame is adequately strong, because we know that not all parents have the expertise to do this. They rely on us establishing standards and then enforcing those with manufacturers. These are incredibly complex platforms that are rapidly evolving, fundamentally changing how our kids see themselves and interact with the world, and parents need help here to interpret and understand their safety.
Good. Thank you both.
Thank you.
Senator Murphy.
Thank you very much, Mr. Chairman. Thank you for holding this very important hearing. I'm so proud of this Congress and many on this committee for passing the Bipartisan Safer Communities Act, and I'm glad to get an update today on how that money is being impactful to help our kids. It's part of a trend. We're spending more money today on mental health than ever before. We've gone from about $155 billion in 2010 to $238 billion in 2020, and it's still not enough. But I think this hearing is so important because I think we have come to the conclusion that unless you get at the root causes of unhappiness and isolation and loneliness, there is almost no amount of money that can make up for that inattention. So, Dr. Murthy, I wanted to continue this conversation about social media, in part because I think it's the most immediate public policy concern that this Congress can tackle, and because I think there's easy agreement between Republicans and Democrats, but not because I think it's the whole story. I think, frankly, we probably spend more time than we should talking about this narrow but very important problem that our kids are facing. But I think we can do something about it, so let's not lose the opportunity. I know the administration hasn't endorsed any specific policy proposals, but just give us your take on which direction we should head. So Senator Schatz and Cotton and Britt and I have a piece of legislation that says you got to do age verification to make sure that you can't get on before you're 13. You can't use algorithm boosting on younger kids, and parents have to have a say. Other legislation says you should have a standard that applies to social media companies so that they're only putting healthy content online. As you look at the sort of cornucopia of policy options that Congress is looking at here, what direction would you point us in to best protect our kids? What are the tactics that the social media companies are using that are most disturbing to you? And I'll just give you, maybe the statistic that is most worrying to me. There's a recent study that shows within 2 minutes of establishing a TikTok account, a teenager can be fed information glorifying suicide. Within 4 minutes of establishing a TikTok account, a teenager can be sent content celebrating eating disorders. That's how quickly really damaging, really dangerous content can get to kids who are in crisis, who are in trouble. And it just compels us in this Congress to do something about it. So give us a little bit of advice.
Well, thanks, Senator. And I just want to also appreciate your leadership on the issue of loneliness and isolation. It's been an honor to work together with you on addressing this. And I agree with you that there are multiple drivers of the mental health crisis. Social media is one of them, and I agree it's an important one for us to address. A few things I would say in terms of avenues to focus on, recognizing that social media has been around for almost 2 decades. During that time, there has been a lot of evolution in the platforms, a lot of different ways in which it is affecting our kids' lives. And so there's actually a lot to do here if we truly want to make them safe. I think one certainly is around enforcement concerning age. Many platforms establish 13 as the age at which kids can use social media. By the way, that is not based on health grounds, the age of 13, and although many people think it is. But 40% of kids 8 through 12 are on social media. So whatever rules the platforms have in place are very poorly enforced. I think the second area we need to protect the privacy, data privacy of kids. Kids, to this point, do not have sufficient control over their data, neither do their parents. This data is often used into direct ads to them and other content as driven by the algorithms. We need to give kids and parents control over that data. The third is actually around data transparency. Companies are not fully disclosing the data they have about the health impacts of their platforms to our kids, to parents, to researchers, and to the public at large. This is what researchers tell us all the time. And without that transparency, we don't even know the full extent of the problem and which kids are most affected, and so it's hard to target interventions. But finally, I would say when it comes to safety standards, this is a place where I do think we can build models off of other products where we've established safety standards, whether it's for cars, car seats, medication, baby formula, whatever you want to consider as a parallel. But the bottom line is we need to have standards that push companies to assure us and to be able to demonstrate through data that they're not exposing our kids to harmful content, that they are not, in fact, allowing kids to be bullied and harassed online, particularly by strangers, and also that they're not promoting the use of features that lead to excessive use. We know that kids are at a vulnerable stage here of development, and they're particularly susceptible to some of these features. We can't have companies taking advantage of those. So these are some areas that I think are essential for us. And I think, I would be happy to work with you and other members of this committee as you develop, legislation around this, because I think this can't come soon enough.
I appreciate our partnership. I appreciate your guidance to this committee. The only thing we cannot afford to do is to stand pat. There's a consensus here that we can find with your help. Thank you very much, Mr. Chairman.
Thank you, Senator Cassidy.
I defer to the senatorially splendid Dr. Marshall.
Well, thank you, Senator Cassidy, and thank you, Chairman Sanders. We have to stop the hemorrhaging. We have to stop the hemorrhaging. When a patient comes to the emergency room and they're bleeding out, we don't start pumping blood into them. The first thing we have to do is stop the bleeding. Most of our solutions today seem to be pumping more blood into people. We got to go back and start over. You know, the greatest healthcare mistake the NIH and CDC ever did was locking our youth out of schools, and that launched this mental health epidemic that we have. You know, irrefutable damage to our children's mental health, and I hope the CDC will own that someday. And instead of our children talking to their friends, their colleagues, their teachers, their coaches, they talk to social media. That became their best friend. So how do we stop that hemorrhaging? I think we have to go back and think about, I look at social media today as worse than pornography. My young sons were exposed to pornography when they were very young because of social media. And I think the additive pressures coming from social media today are worse than pornography. And just like we had to set parameters around pornography, we need to do the same thing with social media. I wish we didn't have to. I think we need to start over on what the solutions are. Dr. Murthy, would you support some type of an electronic Surgeon General's warning on a statement on mental health and the impact of social media?
Well, thank you, Senator Marshall, and it's good to be here with a fellow clinician as well. I know you've seen this from different angles. I do worry about social media as you do, and what I've tried to actually do in the advisory we just issued 2 weeks ago was to put in writing, clear as day, what our concern was about social media, and to issue that warning to the American public. I don't think it's the last thing, though, that we need to do. I think it's a start.
So much like when I was growing up, we put a Surgeon General's warning on tobacco, and it had an impact. I think when we put a Surgeon General's warning on alcohol for pregnant women, it has an impact. Are you willing to use your bully pulpit and say we need a Surgeon General's warning on what is the biggest threat to our youth right now when it comes to their health? This is the #1 threat to our children's health right now. It's not cancer. It's not osteoporosis. It's not a whole lot of things. This is the #1 threat. Are you willing to use your pulpit and put your reputation on the line and say, we need a Surgeon General's warning on social media for youth?
Well, Senator, I do think it would be appropriate to have a warning on social media to warn parents and kids. And if Congress is willing to provide the legislative or regulatory authority to put that label on, then I'd certainly be willing to partner.
Does it take legislation for you to put that label on? I don't know the answer to that.
Yeah, it takes either legislative or regulatory authority to do that.
Okay. Another issue I want to talk about is fentanyl or drug cartels, that they're selling fake Adderall that's, of course, laced with fentanyl. You're well aware of this. And they're using social media. And, of course, the top buyers are children. Senator Shaheen and I wrote legislation with leaders on the Judiciary Committee to hold social media companies accountable for illegal drug sales happening on their platforms. Does this have the support? It does have the support of the White House and the DOJ, and would love to have your continued efforts with this. Any comments on that?
And I think I want to highlight the word you use, accountability, because there's been an utter lack of that when it comes to how we've been addressing the impact of social media on our kids. And what you mentioned, which is the platforms being used to expose our kids to drugs and other harmful content is one example of that. So yes, I would support measures to ensure there was more accountability for the platforms.
Okay. The last thing we need to do is go back and study this, and form committees and pray about this. We know social media is preying on our youth. We know it as surely as alcohol causes infant problems for moms as well. We know it. We don't need to study this more. As black and white as you can make this, what would be your recommendations to stop this from happening? If you own the social media company, why wouldn't you take the responsibility yourselves? Why does it take an act of Congress to do the right damn thing? What would you recommend that they do?
Well, what I mean, this company specifically?
Yes.
Yes. So what I laid out in the advisory are a series of recs for the tech companies specifically. One is to apply age-appropriate design to their platform so they're not exposing young kids to harmful content. Second is to be transparent with the health impacts and the data that they're collecting, so that everybody can see how these platforms are impacting our kids' health. But the truth is, Senator, the social media platforms have been around for nearly 20 years. If we're going to just rely on them to fix this problem, I think we're waiting for something that's not going to happen. Because while they have made some efforts, to put safety measures in place. It's not nearly enough, and it's not happening nearly fast enough.
Greed is a horrible thing. Using greed to take advantage of our youth is a horrible thing. I just call on the social media companies to take self-accountability and to do something about this. Don't wait for Congress to do it. They know what the right thing is to do. They are taking advantage of our youth. They're poisoning our youth. They're killing our youth.
And Senator, I would just say, when you and I have practiced medicine and we've prescribed medicines to people, to patients, we've been able to generally tell them what the evidence is that something works or doesn't work and what the evidence is around safety. I think it's very reasonable for us to expect a company to demonstrate similar data to us, so that as parents, like, we can take that into account as we make decisions for our kids on when to start using social media and whether or not to even use it.
Senator Kane.
Thank you, Mr. Chair, and to our witnesses. What an important hearing, and my colleagues have asked a lot of good questions that I was thinking about asking, but I decided I'd like to just take my time to speak to any young person that's watching this hearing here in the room, or watching it live, or maybe watching it streamed. Young people feeling depressed about the future of the world, feeling hopeless, has many causes, but to some degree, you probably feel that way because you think adults have let you down. Climate change, gun violence, a couple people were killed in my hometown at a high school graduation the other day. Both my kids graduated from that building. My wife and I both spoken in that building. That's where we do all the graduations in Richmond. So I think young people's part of this sense of hopelessness is this feeling that adults have let us down, whether it's on climate or guns or political polarization or kids getting kicked around by adults for political purposes if they're marginalized. I look in my own life, I have a Social Security card now, but I look in my own life can I even remember what it was like to be a 5 to 18-year-old? And I want to tell you, I had the same feeling when I was 5 to 18, that the adults in the world were letting us down. I came home from kindergarten in November of 1963. I saw my mother crying for the first time in front of the television because JFK had been assassinated. I picked up the newspaper in April of 1968 and the news of MLK being assassinated, and then in June of 68, RFK being assassinated. You saw protests about the Vietnam War. You saw protests about civil rights issues. I was 16 when a president was forced to resign because of corruption. So my formative life from 5 to 16 was a time of chaos. War, nuclear weapons drills in the classroom. It was a time of chaos, and there was a palpable feeling that I had and that a lot of my friends had, that the adults in the world were letting us down. And that was a creator of confusion and anxiety and even depression. We weren't so open about talking about mental health and mental health stresses then, but I could just remember that feeling. But what I want to say to young people watching, and Dr. Murthy, your focus on loneliness and isolation really gets at something really important. Young people have the power. Young people have the power to change the reality if you link arms and band together, and to reduce some of the things that might make you feel hopeless or depressed right now. Because in all of that confusion, I saw young people a little older than me. I wasn't in the age, but I saw young people protesting against the war and helping lead to its end. I saw young people in the civil rights movement helping battle to get voting rights done and civil rights laws passed. I saw young people who are now eligible to vote at age 18 becoming deeply engaged in events that led to improvements, that led to a Congress willing to hold a president accountable for impeachable behavior, forcing his resignation. And so the lesson that I learned from 5 to 16 was, yeah, adults were screwing a lot of things up. And if we waited for adults to solve those things, we would wait for a very long time. But when the young high schoolers and college kids that I was looking up to as a younger person linked arms and said, well, we're not going to just wait for adults to fix it. We're going to get engaged. When young people do that, young people change the direction of the country. And so I guess what I would just like to say to any young person watching this is you might not think you have the power to change the conditions that you find depressing. I think an awful lot of young, well, I'm not even old enough to vote yet, or what does one vote matter, or, you know, the system is rigged so that we don't matter. Our history shows the opposite. Things get worse when young people don't engage. Things get better when young people do engage. And not only do they get better in society, but the therapeutic value of linking arms with colleagues to battle for improvements in climate or reductions in gun violence, that very act of forming community among young people has a positive impact not only on society, but on one's sense of well-being. You have a purpose on the table right before you. And if you look at us and you think we're not responsive to you, you can link arms and you can change the world and feel a lot better about the world that you're living in. So with that, Mr. Chair, I yield back.
Thank you, Senator Kane. Senator Cassidy.
Thanks. Thank you, Mr. Chair. In Senator Sanders' opening questions of Dr. Murthy, he suggested, yes, we've done a lot, but we need to do more. But Mrs. Nees, you made it clear that we are actually on a trajectory to do more. Yes, we've put in these programs. For example, you mentioned your testimony, a school in Louisiana that's very successfully instituted a Medicaid-based clinic for those with mental health, and that now there's another one opening, and presumably there'll be another and another and another. So sometimes it's the potential of that which is being realized, which is more important to allow it to be realized than creating a whole new program. So I say that, though. My question is, are my assumptions correct? That the programs that we put in place, for example, to help schools use Medicaid to pay for services, is that increasing in terms of its implementation? And do you suspect that it will continue to increase?
Senator, thank you so much for that question. And we certainly hope that with this Medicaid guide and a new technical assistance center that will be announced shortly, that we're going to make it easier for more and more school districts to figure out how to access Medicaid so they can, in fact, do just the things that you're talking about. We've seen a number of great examples across the country of partnerships. We were just in Delaware.
So let me stop, because I understand you've got these examples, but are you getting, what I'm really asking is, do you have the interest being shown to expand upon these examples to make this even more widely used?
Absolutely.
So the
without
potential is
question.
being realized, and I think that's the point I want to emphasize.
Yes, sir.
Now let me speak to something which perhaps is not being realized, and maybe you can't speak to it directly. But in the bipartisan Safer Communities Act, passing because of Republican support, there was $1 billion for funding physical safety of schools. In one sense, we're trying to address the front end. How do we keep kids from having a problem? But we're also trying to address the back end. A kid does have a problem and comes in and tries to commit violence, or someone else does. As far as I know, the rules to tell schools, districts how to implement physical hardening of their schools has only been promulgated into 3 different states. Why have those rules not been promulgated? Okay, this is what is allowed to physically harden your school in case there's somebody who comes to attempt to commit violence. Why have those not been promulgated to all 50 states?
So, Senator, thank you for that question. The Stronger Connections grant that we released the funds to states last September, and states we were doing listening sessions with key stakeholders on what kinds of things they wanted to use those funds for. And our guidance that was put out in November and again revised this past March does help schools understand what are allowable activities. What we're hearing from states...
Let me stop you. Again, being specific with my question.
Yes, sir.
I was called by my state superintendent that they were being told that they could not use the money to physically harden a school. I spoke with the secretary, and he said he would correct that, but I'm told, maybe I'm wrong, that the correction that says that schools may use the money, as Congress intended, by the way,
Correct.
to physically harden, was only promulgated to 3 states, Louisiana being one of them. Am I correct on that, or am I wrong?
Senator, I'm not aware of. My understanding is, from what we've heard from states, that they have used these funds for things to increase the physical security of schools.
Now, that's different from hardening. So if I can ask, can you get back with me on the particulars of that most updated information?
Yes, sir, be happy to do that.
Next, it's been suggested several times that there are things which subject children to ridicule that can otherwise make them prone to these episodes of depression, et cetera. I'm very concerned about the issue of dyslexia. I think anyone that has a child stands up that can't read in front of a class and is ridiculed because she can't read understands that pain.
Absolutely.
Now, there's a lot of money put out in these bills to help school districts do catch-up learning, and I mentioned dyslexics because they're particularly vulnerable. Here's an article, though, from the Times from 3 days ago. Schools receive billions in stimulus funds that may not be doing enough. Pandemic aid was supposed to help students recover from learning loss, but results have been mixed. And it points out that there was little guidance given to schools beyond you shall spend 20% of it. There are some schools that have put in very good programs, small focused learning, and others that apparently have not. Any comments on that? And specifically, what can, knowing the money's about to run out, but what can we do now to try and get schools to use best practices as opposed to just frittering dollars away?
Right. Senator, one of the key elements of the federal special education law is child find. And one of the things that states have struggled with that we are working very closely with them on to address is making sure they are identifying and serving any eligible child. And certainly students who have dyslexia are among those kids that we want
I
to
get
see
that,
served.
but there's best practices. It does not appear as if they were universally adopted.
That's correct, sir. We are working on specific guidance on these specific issues so that states can fully understand what their responsibilities are so they can make that, so that we can have a different situation.
Yield.
Senator Hassan.
Thank you very much, Mr. Chair and Ranking Member, for this hearing. Thanks to our witnesses, not only for being here today, but for the work that you do. And I just want to start by following up a little bit on what Senator Kaine was talking about. I think we all have been hearing from constituents about concerns about mental health, in particular children's mental health. I will tell you that in the spring of 2021, when schools in New Hampshire began to reopen more fully, I went and visited in one of my local school districts with a mix of students and teachers and administrators, students from first grade all the way through high school. And I was struck towards the end of the discussion when we had been talking about how kids were doing, how their families were doing, what the schedule in school felt like, did they feel that they were keeping up with their learning, how the year had been, when a girl who must have been about 10 turned to me and said, "So, Senator, what are you doing about mental health?" Mm-hmm. And I had been kind of dancing around it. I'm from a generation where we didn't talk about mental health in the same way we talked about so-called physical health. Then recently, another one of my constituents, Laura Lee, who is 18 years old, raised awareness about mental health because she was driving with a friend one day and the friend had a panic attack and Laura Lee didn't know what to do. So now Laura Lee is working to help students get that kind of understanding for mental health first aid. What can kids do to help each other in these moments where they need to be supported and until they can get professional help. So I also want to encourage young people to know that when you speak up, your representatives hear it, and we're doing our best to listen, and we are trying to make progress. And I want to ask a couple of questions to our witnesses about some of the progress we've made. Sometimes it doesn't seem enough, fast enough, but it is really important to understand the building blocks that maybe are in place. So let me start with a question to Dr. Murthy. I really enjoyed our discussion, Doctor, in my office yesterday, and my team appreciated it very much, too. Last year, my colleague, Senator Ernst, and I led something called the Stand Up Act, which was passed into law. And it's a law that helps ensure that schools are using suicide prevention policies that are actually evidence-based. So, Dr. Murthy, why is it important for schools to adopt policies that are evidence-based? Senator Cassidy was just talking about our schools using the resources we're giving them in the right way. Why is it important that they're evidence-based, especially given the increased mental health risks that our youth face from social media?
Well, thank you, Senator. And Laura Lee's story will remain with me, and something I want to say about that at the end. But specifically to your question, having evidence-based practices is important because sometimes even with the best of intentions, our programs may not have the desired effect.
Right.
Either in terms of the extent of impact or in terms of who they're impacting, they may leave certain people behind. The only way we really know that is to study them. The other piece is that sometimes when we study programs well, we realize that there may be unintended consequences of those programs. They may help in some areas, actually harm in others. Right. And that's the whole point of studying these programs and then making sure that people know what the evidence tells us so that the program, when they do finally invest resources, time, and effort, they can do it in programs that we have greater confidence will actually help.
Yeah, good. So let me then ask a question to you, Ms. Nees. This is another example coming out of New Hampshire. Our University of New Hampshire and Manchester School District, which is our biggest school district in New Hampshire, they're leveraging funds from the Bipartisan Safer Communities Act to train and place 80 graduate students studying social work in high school, in high needs schools, high schools and elementary and middle schools. These graduate students will benefit from a year-long internship with on-the-job training while public school students receive needed services. So, Mrs. Nees, in addition to this innovative example from my state, what other innovative local solutions are you seeing school districts deploy to address the school mental health personnel shortage?
Senator, one of my favorite questions. We've seen some really innovative things across the country. We were just in a school in Delaware where the Children's Hospital runs a clinic that's on the campus of the school. The majority of these children in this elementary school are homeless and live in nearby shelters. The year before the clinic was on staff, they had more than 1,000 instances of disruptive behavior that resulted in suspensions. The first year of the center, that 1,000 number went down to 100, and now there are virtually none. It's a great partnership. The Children's Hospital staffs it, does all the billing, and the school provides the physical space. What the principal said to me, I said, "What keeps you up at night?" And he said, "Learning loss." He said, "We've got the support for kids, and that the teachers don't have to be both therapist and teacher."
Right.
And that the staff there help teachers figure out how to get through the day to support kids so that they're emotionally okay and learning. And I think that's one of the greatest things that we're seeing is that partnership between educators and mental health providers on behalf of children where children are.
Well, thank you very much. Thank you, Mr. Chair, for your indulgence. I have some other questions, too, including the importance of providing services in summer programs and summer camps, which is something I think I'll follow up with our witnesses on. And lastly, again, to the young people watching, this hearing probably wouldn't be happening if young people hadn't been speaking up. So thank you all very much for that.
Senator Smith.
Thank you, Chair Sanders and Ranking Member Cassidy, and thanks so much to both of you for being here. So when I was a sophomore in college, I was really struggling. And thanks to my roommate, who recognized some of the signals and signs with somebody who's dealing with depression, she suggested that I go to a school counselor at my university. And man, that made a huge difference. I don't think I would have done that on my own. And I can see now that I was struggling also in high school. But having access to that care in my school setting made a huge difference because the barriers and the stigma that I would have experienced were sort of stripped away. And I share this story often, especially with young people, because I can see them kind of go, oh, finally, somebody is being real about this with me. This is one of the reasons why I've been so focused on expanding access to school-based care. And Ms. Nees, I'm really excited about the support that we have put behind school-based services. I've heard from places in Minnesota where we're doing this, especially in places, this is something I've been working on, helping schools partner with community-based organizations to get those services in schools. It makes a huge difference. But here's the thing. In Minnesota, we're go-getters. All of this money, 3 higher education institutions focused on training, that's fantastic. 1 school district has pursued this so far. So can you talk to us just a little bit about, because I have this feeling that we're sort of constantly putting grant opportunities in front of school districts. Some of them, especially rural districts, just do not have the capacity to even know about these opportunities, let alone act on them. Could you talk a little bit about that issue and how we are putting resources out there that is actually not that accessible to a lot of schools?
Absolutely, and thank you very much for that question. And we hear that all the time about capacity, especially small districts not able to write for these opportunities. It's one of the many motivators to our Medicaid work,
Right.
where we're really trying hard to make it possible for people that are in schools to work with their Medicaid agencies so that we know we've got lots of kids. Half the kids in our public schools are eligible for Medicaid. If we can help schools figure out how to recoup some of those
Exactly.
payments, they can sustain things. They don't have to write a grant. And again, we know that with the 21 states that have access to free care rule, that's resulting in almost $6 billion of revenue to schools for services they want to provide. And that's, to me, how do we need the more people, and the people, we need to train more people, and that's something that you can do with grants. But I want this to be sustainable.
They need sustainable
for the long
funding.
term.
Yes, exactly.
And for small school districts to not be left out of that's really what we hope the TA Center and the guidance and our efforts to shine a light on this opportunity, that we can have more of that happen.
And let me just ask for clarification. How many states did you say are participating in this right now?
21.
21. So only less than half of the states are participating. And that is a decision essentially of the governor and the legislature.
Correct.
So this is another problem we have, Mr. Chair, is that in some places there's opportunity, in some places they're not, based on the calculations that state leaders have. Vice Admiral Murph, I'm used to calling you Vivek, so.
Call me Vivek.
You and I have had some really terrific conversations. I'm so grateful for your leadership on issues of social isolation, both for our elders as well as for young people. Now, I've had people say to me, Tina, like, you can't legislate away loneliness. But you've done research that really shows how we can think about this as a social determinant of people's health, and that can make a huge difference. Could you just speak briefly to that? Because I think it's really important.
Absolutely. And I think I agree that you can't legislate away loneliness, but I don't think that that's the solution here.
Right.
I think there are steps government can take to help support community organizations, to invest in research, to understand more deeply the drivers and solutions to loneliness. But we also need community organizations, families, individuals, to recognize that this is an important priority for all of us. I worry that we have become a lonely and disconnected nation, and that has massive consequences for our mental health, for our physical health, for economic prosperity, for our ability to pull together in the face of adversity, whether that's a pandemic or another hardship. And for all of those reasons, I believe that addressing loneliness is a strategic and critical priority for our country. It's something I think we can do, and the people who give me most faith that we can do that are young people, because when I talk to them around the country, they are not waiting for others to step in. They are building programs at their schools to help connect one another. They're reaching out to support each other. They're talking more openly about mental health and issues like loneliness than any prior generation, and I think their leadership is going to be vital in us addressing this challenge.
Thank you. Thank you so much, Mr. Chair.
Thank you. Senator Murkowski.
Thank you, Mr. Chairman, and thank you for the hearing this morning. I think it is somewhat telling that with everything that is happening this morning, there is a significant overflow room just down the hall. I've been back and forth between a couple different committee hearings this morning, and there continues to be a line of young people trying to get into this committee hearing. And so I've stopped and talked to them. Why are you standing in this line today? Why is it important to you? And one of the young men said, it's personally important to me. I'm curious to know apparently as a young immigrant, the intersection, the services that are available for those from other areas. Another one indicated that she was interested in education, but she wanted to understand more how people who had adverse incidents in their lives as young kids, as she had, what more support could be provided in schools. Young people are paying attention to this as an issue. They're paying attention to what we as legislators do. And I've listened to some of my colleagues, and yeah, we can't legislate loneliness going away. It's hard enough how do you legislate against bullying? How do we do the reach out? I appreciated your comments to Senator Tupperville when he mentioned that as a coach, he interacted directly with these young people, and your comment that you sat down at round tables with students, particularly student athletes. What more are we doing to ask young people what the solutions are? We had a hearing in this, in the Help Committee last year on youth mental health. We invited an extraordinary young Alaskan by the name of Claire Rainier. I think Claire at the time was 19. She gave testimony and presented the youth perspective and what she had done as one individual that had gone through real crisis, what she had done within her school community to engage more. And I remember Claire's story and how strong she was in sharing that with us. But what are we doing to ask the young people what we can do to help? And I'll throw that out to you, Surgeon General.
Well, thanks so much, Senator.
And I understand you're
Cassidy.
coming to Alaska soon, and
I
hopefully
am.
those conversations are going to take place.
Thank you. Yes, I'm really looking forward to it. And it's actually relevant. Like when I first came to Alaska, when you and I met there in 2016, that was an opportunity actually where we did a lot of roundtables, including with young people. And the goal there was to really understand how they're being impacted by substance use disorders and more broadly by behavioral health concerns. To involve young people, to answer your question, I think there are a few things we have to do and that we are doing more and more of. Number one is we've got to bring young people to the table to understand and hear their concerns and go to where they are. And so that's part of what my office has been doing is having roundtables with young people in communities across the country. The second thing we have to do...
Can I just stop you there?
Of course.
Because it takes extraordinary strength for a young person to say, no, I want to be part of this public dialogue and engagement. The ones that are really hurting are the ones that are just struggling to get up out of bed that morning, much less go to a round table. How do we get them?
That's exactly right. And that's why what we're also doing is recognizing that it's not easy for everyone to come to those tables to be open. It's easier often when they are doing that with folks they know, with trusted institutions, trusted organizations. So we're also working with faith organizations, with universities and others to help them pull roundtables and other such listening sessions together with young people to create opportunities for them to give input that don't necessarily involve showing up at a roundtable, but may involve more commenting on a survey or sharing their input anonymously. We want to create as many channels as possible for young people to be heard on this. And then using that input, we're encouraging mayors as well as the institutions I mentioned to then formulate their plans. My belief is that if we want to do something that's going to help young people here, we need them at the table throughout the process, before we develop the solution, as we work on execution, and when we do evaluation to understand whether it's working or not. And that is what we are encouraging localities to do, from mayors to non-governmental organizations like YMCAs, educational institutions and others. But Senator, it's not, I'll just say this, it's not easy to do this, right? It takes time, effort, and focus and continued attention. The easiest thing is just to go into a closed room and to come up with your own solutions and try to implement them. But I just don't think that is what's going to get us the best result here.
Agreed, recognize that we just need to be doing more to be inclusive of these young people. I'm going to have a question for the record for you, Mrs. Ness, and this is relating to the fact that of the Bipartisan Safer Communities Act funding through the Mental Health Services Grant, Professional Demonstration Grant programs, apparently only 17% of these grants were awarded to rural districts. And so I'm trying to understand what more we can be doing to make sure that these grant resources are going out to all areas of the country, including rural. Thank you, Mr. Chairman.
Thank you very much. Senator Baldwin.
Thank you, Mr. Chairman. In June, we celebrate Pride. It's a time for folks to gather and lift up and celebrate LGBTQ Americans, the movement for the fight for equality. And we also reflect upon the challenges. And there's an intersection of our conversation here. It's already come up a little bit, that with the mental health crisis that kids are facing, from data last year, 45% of LGBTQ youth reported that they had considered attempting suicide. 45%. Youth who live in communities that are not particularly accepting, or families that aren't particularly accepting, report higher rates of attempting suicide. I'm just going to note, and maybe we can introduce it for the record, there was an article last weekend in the New York Times about death investigations and the fact that we don't have complete, after suicides, we don't have complete information because oftentimes they don't ask the question about sexual orientation or gender identity. But in Utah, they are. And it was a fascinating piece that we should have as a part of the record, because that's data that we're lacking. But at the same time we're celebrating Pride Month, we are witnessing in America a staggering number of pieces of legislation at the state level that are described as anti-LGBTQ bills. 491 reported so far this year. At the state and local level, school board level, we see a lot of additional activity. I don't have any numbers on that. I don't know who's aggregating those, but it's rampant. And I wonder, again, what the impact of that is on mental health of members of the LGBTQ community. Now, I want to get to a question. We're talking about offering support in schools, but I want to also think of other gateways where people come in and get help. I was proud to co-sponsor the bill that brought us the 988 suicide prevention hotline, and it was made, became operational last summer. And there's the ability with that technology to provide more customized service. I know the first thing people are asked, are you a veteran? And if so, you'll get your mental health services, if you choose, from the VA. But we, along with Susan Collins, we have provided funding for a pilot program in 988 for offering specialized support for people who call, text, or chat on 988 who are identifying as LGBTQ. So how do we use, we have school-based mental health in some cases, but how do we use a gateway like 988 to provide better support for, in particular, our LGBTQ population?
Well, Senator, first, thank you for your leadership on 988. As it's a topic that I talk about often when I travel around the country, and I can't tell you how many faces I've seen turn from worry to a look of relief when they know that there's some help actually available immediately when they or their child have a crisis. So thank you for that. It's already making a difference. I do want to say specifically with LGBTQ youth, I agree with you that we need to look for more ways to ensure that they know help is available for them. I think schools are a natural place. I think 988 is a place where early on, if we can signal to young people that this is a place where you can get assistance, where people will understand your unique circumstance and your background, I do think that that is essential. I also think that, and I say this just, as a doctor and as a father, I believe that every child deserves to know they matter, regardless of what their background is. The reason my parents came to America many years ago was because they wanted my sister and me to grow up in a country where we knew that just because we had a different color of our skin or our name sounded funny or our background was different, it didn't mean that we mattered any less than any other child. And that's a value we aspire to as a country. You know, we may not always have gotten there, but I think that's a place where we need to do more when it comes to making LGBTQ youth feel that they do matter, that they are valued. And too many of them tell me often that they don't feel that way. They often feel left out or bullied or attacked. And finally, I would just urge leaders, whether they're elected leaders, whether they are leaders in the community, to include LGBTQ youth at the table when they're listening to what communities have to say, and just specifically reach out to them to understand their perspective and their life experience. I've just learned as a doctor over the years who's had the privilege of sitting with patients and who have very different backgrounds and listening and learning to them, that there is nothing that replaces face-to-face contact with people, listening to someone's story, and it shifts how we think about issues. And I think that could not be more important now because too many of our LGBTQ youth are struggling, and you see it in the suicide rates. And to me, that is a 5-alarm fire that we're dealing with.
Yes, thank you. Mr. Chairman, I have several questions for the record since I've run out of time, but I thank our witnesses.
Well, thank you very much, Senator Baldwin. And let me thank the panelists for, I think, is an extraordinarily interesting hearing on this subject that I think everybody here recognizes is of enormous consequence to this country. And I just want to take a few seconds to make this point. I think we're all proud of the accomplishments that we have made, and we want to tout them. But there's another reality, and I want you to tell me what I'm missing here, if I am missing anything. If 85 million Americans are uninsured or underinsured, and if we have a scarcity of mental health providers in this country, am I missing something in suggesting that for tens of millions of people, I know people call my office, I'm sure they call other offices, my husband's in desperate shape. I can't find the help. We can't afford the help. And on top of that, correct me if I'm wrong, but I think as a result of the ending of the public health emergency, some 17 million people are going to be dropped from the Medicaid rolls. Is that correct, Mrs. Nice, is that correct?
I'm not, I know that it's a large number, sir. I'm not exactly
So the
sure.
point is, yes, we want to take pride in what we have accomplished, but let's not kid ourselves. We have got to move dramatically if we are serious about protecting the mental health and helping people in this country. There's a lot of work that has to be done. With that,
I will take 30 seconds.
okay, yeah, Senator Cassidy. Well, let me just, with that, all right, give it mic to Senator Cassidy.
A lot of great things said today. On my closing 30 seconds, I want to emphasize 3 things. Senator Kane speaking about how young people can be the drivers of change. Senator Murkowski speaking about how folks are lined up and they're all young. Looking at the audience here, you're young, and I suspect those watching on TV are young. And Dr. Murthy saying that we can't leave it up to government, but we also have to have individual action. So I guess my appeal is all the young people who rightly have a concern about this. You are the ones who can introduce people to this hotline set up by Senator Baldwin. You're the ones that can advise, as Senator Smith was advised, to go seek help. We can only do so much. Y'all can do a heck of a lot more than we. So I just finished by echoing wonderful comments from my colleagues.
All right, to the witnesses, thank you very, very much. This is the end of our first panel. We're going to begin our second panel in a moment. Thank you. Thank you all very much for being here, and we're going to continue this discussion on this issue of enormous concern to the American people. And Senator Murphy was going to introduce Charlene Russell Tucker, but unfortunately he is detained. So let me begin by introducing her, and that is Mrs. Russell Tucker was appointed Commissioner of the Connecticut Department of Education in 2021. Previously, she served as Chief Operating Officer and Division Chief for the Department's Office of Student Supports and Organizational Effectiveness. Mrs. Russell Tucker, thanks so much for being with us.
Thank you. Good morning, Chairman Sanders, Ranking Member Cassidy, and members of the Senate Committee on Health, Education, Labor, and Pensions. I am Charlene Russell Tucker, Commissioner of Education in Connecticut. I am honored to share critical information regarding the youth mental health crisis and Connecticut's response to support the needs of our students. My big, audacious goal is to ensure every Connecticut school has a coordinated and sustainable system of care to provide comprehensive behavioral and mental health supports and services to all students and school staff. As Surgeon General Murphy mentioned, and a survey of Connecticut high school students confirms, our students face unprecedented mental health challenges. Too many of our students reported having felt sad or hopeless, and that their mental health was not good most or all of the time. Most concerning is that 14% said they had seriously considered suicide, and 6% actually attempted suicide. These data highlight the immense need to address student wellness and underscore the urgency for action at federal, state, and local levels. Effective solutions require teams of stakeholders, including policymakers, community leaders, parents and families, educators, and students. I like to say it can't be about them without them. The Commissioners' Roundtable for Family and Community Engagement in Education is a diverse constituent group of stakeholders representing school staff, advocates, parents and guardians, community leaders, and students to advise me on policy and programmatic priorities. Connecticut's Student Voice for Change program allows high school students to propose projects utilizing state ESSER funds. Notably, 80% of student proposals focused on mental health, using their voice to advocate for mental health supports for their peers. They spoke, and we are listening. Our ESSER-funded behavioral health pilot established a system of coordinated care for schools in 7 districts. One pilot school district identified 250 students at risk of suicide and was able to provide critical and immediate responses. Our state's mobile crisis intervention services delivers a range of crisis response and stabilization services to youth and families. Simply calling 211 or now 988 immediately dispatch clinicians to schools or anywhere a child is in crisis. The Surgeon General report on the epidemic of loneliness reinforces the importance of school attendance and engagement. Our Governor's Learner Engagement and Attendance Program is a research-based home visiting initiative that improves attendance, feelings of belonging, and family-school relationships. Additionally, we invested $33 million in ESSER and ARPA funding in a multi-year summer enrichment grant program, prioritizing communities disproportionately impacted by the pandemic. Programs place a strong focus on peer relationships, wellness, and academic acceleration during the summer. In the first year, this program connected more than 108,000 students with enrichment opportunities. The department invested $2.2 million in ESSER funds for innovation grants to support new partners in underserved communities in designing innovative, high-quality after-school programs to address students' academic and mental health needs. Mental health is a bipartisan state priority, including addressing workforce shortages. Governor Lamont and our General Assembly directed $100 million for multi-agency mental health initiatives, including $28 million for mental health professionals in schools. Multi-state agencies are working together to expand the ranks of clinicians to meet increasing mental health needs. Additionally, our school districts are leveraging over $183 million of local ESSER funds for student and staff well-being. We are committed to funding and sustaining what works. We also invested ESSER funds to establish a groundbreaking collaborative that brings together teams of university researchers to conduct rigorous evaluations of the many new programs and initiatives that's underway in our state to ensure programs and investments are achieving results. Thank you for modeling bipartisan national discourse that will lead to enhanced access to needed services and ultimately improved academic access, supports, and outcomes for our young people. Thank you very much. I'm happy to take your questions.
Thank you very much. We're going to jump over Dr. Garcia for a second. We're going to go to Dr. Joy Osofsky, who will be introduced by Senator Cassidy.
It's a joy to introduce Dr. Joy Osofsky. She's the head of pediatric mental health at LSU Medical School, a developmental psychologist and a national leader in early childhood development. I've learned a lot from Dr. Osofsky. She is who taught me that you can actually begin picking up separation disorder from day zero. It was just amazing to me. And she was very influential in what Chris Murphy and I did, at least my part of, the Mental Health Reform Bill of 2016, so I owe a lot to her. She has expertise in trauma-informed care, helped many Louisiana families recover from Hurricane Katrina, and apply that expertise during the COVID-19 pandemic. She's received numerous awards and recognition for her work. Dr. Osofsky, thank you for being here.
Thank you very much, Senator Cassidy, for the invitation, and Senator Sanders. I very much appreciate being here. One of the things that I want to say in introducing my testimony is how important the opportunity has been for me, actually together with my husband, who's a psychiatrist, to be able to consult with Senator Cassidy on mental health issues, to identify and support community and state agencies that work individually and collaboratively in supporting the mental health needs of children and families, including cross-state efforts, and we started this in 2016. We've been pleased to support his efforts to increase mental health support in schools and in communities, and we didn't talk earlier as much about communities, and I think we need to integrate that in the conversation we have now. Partisan Safe Communities Act and Support Act would expand community-based behavioral health services and access to mental health care services in schools and communities in both rural and urban areas. And we know in rural areas, it's much harder to access mental health services in general. The Act would provide funding also for the National Child Traumatic Stress Network to improve trauma-informed training, treatment, and services for children, adolescents, and families who've experienced trauma. I've been fortunate enough to work with the National Child Traumatic Stress Network, being funded since 2003. To develop mental health collaboration with schools and communities. And our latest effort, and I think one that is really very much reflective of the direction that the National Child Traumatic Stress Network is going, has been to not just work in one community, but develop regional coalitions so that we spread the work that we do and the efforts that each of us make in working with children who've been traumatized in different ways and experienced trauma, to be able to share that knowledge with other communities. For example, and it actually happened to be quite fortunate during the COVID pandemic, we had a center within the National Child Traumatic Stress Network that just ended, the Terrorism and Disaster Coalition for Child and Family Resilience. And through that coalition, we built regional relationships across states, one in the Gulf South, where we already had relationships due to the disasters, Hurricane Katrina and the Gulf oil spill, but then in the Northeast region of the United States across 5 states. And the regional coalitions are composed of people from all different backgrounds, state agencies, education agencies, stakeholders in the community, people who are involved in policy. We had some politicians involved, so that we are able to share information across the different group for much better preparedness as we share information, response, and then recovery when a disaster of any type occurs, not just a natural or technological disaster, but also a terrorism attack or a shooting that has occurred in a community or a shooting that's occurred in schools, that we can share information and have immediate response to those situations. I really feel that the work of the National Child Traumatic Stress Network speaks to some of the issues that has already come up in terms of integrating across community and innovative ways to provide mental health services in ways that would be quite acceptable. The other thing that I want to bring up that has not been discussed is the importance of how to support resilience. How to support resilience in children and how to support resilience in families. Certainly we've seen families being pressed immeasurably during the COVID pandemic. What I call it is indefinite information. Everything changed all the time. Indefinite uncertainty. We didn't know what was going to happen from one day to the next. How can a family come together and how can a school system or a community come together when you don't know how things are going to change from day to day? And the issue came up of how to communicate, and I think that's why there's been so much excess use of social media as a way to connect. We were told we couldn't be around people, so how can children relate to their friends? And how can one have a sense of family if you can't see people and relate to them? So I think that it's really very important for us to think about how to establish connections across families and connections across communities. One of them, see I'm just about out of time, I was going to give you a brief example how we brought together families and children after Hurricane Katrina on some of the cruise ships that housed people who did not have housing, and how we worked together, including mental health as a way of just being there. That's something that we have to think about also as supporting parents to be able to just be there and listen to their children and give support to parents to be able to do that. Thank you very much.
Thank you. Our next witness is Dr. Joshua Garcia. Dr. Garcia is the superintendent of the Tacoma, Washington School District. He previously served as deputy superintendent, assistant superintendent, high school principal, assistant principal, athletic director, and teacher. Other than that, not much, huh? All right. Thanks very much for being with us, Dr. Garcia.
Chairman Sanders, Ranking Member Cassidy, and members of the committee, I am the proud superintendent of Tacoma School District and honored to share the viewpoint of superintendents for this important hearing focused on mental health of our nation's youth, and to speak with you about what we've observed, what we've been doing, and what we might do together to curb the youth mental health crisis in America. Tacoma is fully committed to each of our students being safe, engaged, supported, healthy, and challenged. We recognize mental health impacts us all. Mental health includes our emotional, psychological, and social well-being. It affects how we think and act. It helps us determine how we handle stress, relate to others, and make healthy choices. During a highly critical phase of development, the lack of support and comprehensive approaches are significantly impacting our students' ability to grow socially, emotionally, and their academic development. Tacoma Public Schools' more than 28,000 students represent 170 tribes and ethnicities. Over 2,000 of our students qualify as homeless, over 55% of our students qualify as low income, and over 15% qualify for special education students. In the 2011-12 school year, each of our high schools was labeled as a dropout factory. We were in a dire state, and we needed a new approach. We started the Tacoma Whole Child Initiative, an intentional action plan that recognizes students are learning 24 hours a day, 7 days a week. Fast forward to 2022, 90.2% of our students graduate in 4 years, 86.7% of our high schools take college-level classes. This year alone, over 12,000 participants in kindergarten through 8th grade have engaged in after-school activity, and a record number of high school students are participating in paid job experience. Tacoma has been able to make big strides to prove outcomes, but we know the challenges our students are facing are only growing. In the last year, our students, Tony, Angel, Brielle, Isaiah, Marco, DJ, Wyatt, Xavier, Larry, and Ayana have been shot in our community. Our students have to survive human trafficking, battle homelessness, drug abuse, physical and mental abuse, and social media harassment and bullying. Although these may not be new challenges to us as a nation, the speed of the incidences and the traumatic stress are only increasing. Like you and I, our students are being bombarded with images, news events, daily experiences of trauma and hate and stress. Unlike us, they are doing this without fully developed brains, coping skills, or access to preventive and therapeutic services. In 2021, 13,239 of our 10th graders in our states made a plan for suicide. As you heard, Washington State is not unique. Our students are facing tremendous challenges, and schools can't do this work alone. Through the Tacoma Whole Child Initiative, we've moved away from episodic events to sustainable practices across our buildings and our community. They are focused on 3 elements: prevention strategies, response strategies, and therapeutic services. Our prevention strategies. Each of our schools develop an intentional plan to support social emotional learning. They contextualize each plan at each school site. Our students are engaged in physical and mental wellness supports during the day and in the after-school ecosystem. We do this with the Beyond the Bell and Club B, which uses a shared business model, common mental health supports, community assets, and aligned funding with over 70 partners. Our system of positive behavioral supports ensures students understand school-wide expectation, fostering stability, and reinforcing healthy mental health habits. We also provide a safe space for our students to build belonging during evening and non-school hours. Our responsive strategies. We've invested in professional development focused on trauma-sensitive practice. We support and train, facilitate restorative practice that bring voice with intentional healing and understanding. And we also provide tiered supports focusing on target and intensive supports for students at risk. Using ESSER and U.S. Department of Education grants, we were able to invest in therapeutic supports. During a robust prevention and strategy, TPS is not able to alone meet the needs. To meet this challenge, we are implementing an ambitious plan to increase the ratio of students to mental health providers. Here's a few things I encourage us to think about doing together. Expand on the bipartisan Safer Communities Ask. I know budget decisions are tough, but what the message students are telling us we have to listen to. Pay for healthcare services with healthcare dollars to ensure Medicaid access. Incentivize the healthcare industry to have formalized partners with schools, prioritizing youth first. Build on categorical funding opportunities. Increase flexibility with the support for the Carl Perkins and Department of Labor grants to build hope. Require states to match your investment. Has Tacoma done everything we could? Not yet. Tacoma is learning, responding, and making a difference. We have evidence. We know that through engagement, tiered supports, and shared strategies, our students are being more successful dealing with their individual emotions and stresses, developing their social awareness, and working academically at all times. And finally, America's schools and individual communities can't do this alone. We must work in partnership, and we know that it's not easy. There are egos, turf battles, and frustrations. However, we are truly better together. We may not be united on everything, but our future is with us now, and we must be united in our commitment to serving youth first. Thank you.
Thank you very much. Let me begin the questioning. Mrs. Russell Tucker, you mentioned the importance of after-school and summer programs, and I think one of the things we all agree on is that we're going to have to do a lot of treatment, but on the other hand, we're going to have to give young people a lot of positive community-based activity. Can you talk a little bit about the impact that increased funding for summer and after-school programs has had in Connecticut?
Thank you, Senator. Really important and I appreciate that question because it's such an important piece of the work that we've been doing. Under our ARP ESSER funding, that we received $11 million for summer enrichment, and we immediately put that to work. And our state stepped up and added more funding for the subsequent summers, and so we're now up to $33 million of state investment around summer enrichment. We're able in that space, the first summer was to really try to get students back together, back with their peers, back in that environment, allowing them to work with sometimes behavior therapists in that space while they're having really good time with each other, right? So it is an enrichment which was so important. And so we've been able now, we've also evaluated the impact of that reimbursement. As I mentioned in my testimony, over 108,000 students were served that first summer. We're now into summer number 3. And we're evaluating it rigorously to make sure we know what's happening and so that we can make it.
And let me guess that you would like Congress to continue that kind of funding.
Continue,
That a good guess?
Exactly. Fund what works. Right, that's when we're thinking about sustainability. Same is true for our after-school program that we also receive funding to support.
We significantly expanded those programs in the American Rescue Plan.
Yes, absolutely. And so it's important that we are funding what works, and that's why I'm so proud that we're evaluating the impact of those investments.
Okay, Dr. Garcia, I want you to pick up on that. Again, we want to treat the millions of young people who are struggling, but we also want to challenge them. We want to bring them together. We want to have proactive activities. It sounds to me like in Tacoma, you are challenging young people. You're trying to provide job opportunities, among other things. Talk about the importance of treating young people with respect and allowing them to use their energies in productive ways.
Thank you, Senator. I think it's important that each community has the opportunity to define what respect, responsible, and safe looks like. And that's what our social emotional learning plans do. They bring student voice to that conversation, they bring staff voice to that conversation, and they bring family voice. Each of our plans is published, so Stanley...
And young people are involved in the development of those plans.
Absolutely, absolutely. And they define what it looks like in each location, right? Respect looks a little differently in a classroom than it does in a lunchroom. Right? There's different settings. It looks different than in your neighborhood. And so we have to build community through a common language, and that's important. We bring respect, and what does that look in the after-school world? How do we hear their voice, and what are the activities that they want to participate in? So it's very much an intentional effort to bring community together to define that, but those common words are across all town.
And I'm gathering that the empowerment of young people, giving them a voice in the community, has a positive impact on mental health, among other things.
We bring voice in several ways, and we also hear from students. Students have asked me, they've said, Josh, stop asking us our opinions and bringing others to ask our opinions if the adults aren't going to do anything. And that's a really important message. So we bring voice through empathy interviews. We bring data around positive interactions. We have student voice at our board meetings. Students will vote with their feet, if you will. The increased activities and extracurricular activities, not what the adults want to offer, but what do they want to participate in. They've also told us they don't want to be engaged in the business model. They want to know the activity of that. Good. We survey their interests regularly.
Okay, let me ask Dr. Osofsky a question. You use the term indefinite uncertainty. What impact, you walk through the streets of Washington this morning, you breathe the air, which is a result of terrible fires in Canada. Young people worry about climate change. We've heard discussions, as Senator Kaine mentioned, his own school, gun violence in the school, kids worry about gun violence. Families all over the country are struggling economically, Louisiana, Vermont. What impact does all of that and more have in indefinite uncertainty about worrying what the future is going to look for these young people, whether there will be a decent future from an environmental point of view, from an economic point of view, from a violence-free point of view? What impact is that having on the lives of young people?
I really appreciate your asking that question, because this is something that I struggle with, and a lot of us struggle with as in the mental health world. What children need of all ages growing up is they need to have schedules. They need to have routines. They need to know what's expected. So, for example, having a schedule of knowing they get up in the morning and they go to school, and who's going to pick them up at school or where they're going to go and what their activity might be. And what happened, unfortunately, with the COVID pandemic is that changed continually. So one of the things that we recommended is, set a new schedule. Have the children involved with setting the schedule so there's something predictable for them. But it went on for a very long time in that way. We also tried to support the parents, too, because parents didn't have a schedule either. Instead of getting up and if they went to work, going to work and doing whatever, they were having to balance that with educating their children virtually if they were fortunate to have the internet and the equipment that's needed to do that. And every day that changed as well for them. The other thing that's very important for the young people is their peers at every age. For the younger children, being able to play with them and get to know them. For the older children, we know that it gets more complicated in adolescence and that kind of thing, which, as I mentioned, contributes to some of the extensive use of social media. So it's very, very important now that schools are open again for there to be that kind of schedule and things that parents can count on and children can count on to be able to move forward. I also wanted to make a comment on the involvement of youth. We found that to be extremely helpful after there was so much destruction with Hurricane Katrina, that there were a lot of teenagers who were on the streets because there was nothing there for them to do with themselves. There were no activities. So we involved them with recovery. And the teachers who also didn't have classrooms in schools, they involved with recovery so that the teenagers, instead of being in trouble, were able to contribute in positive ways.
Okay, thank you very much. My time has long expired. Who's it, Senator Braun or Senator Cassidy? Senator Cassidy.
Dr. Ossowski, in some schools, they're limiting information sharing between parents and teachers, effectively cutting parents out of their child's life. What does your research say about the role of parents when students are going through traumatic experiences?
That's such an important issue that you bring up, Senator Cassidy, because we know the important role that parents play for children, to be there for them, to listen, to advise them, and to be very much a part of their life. One of the studies that was done during COVID by Sesame Workshop sent out information to families, different backgrounds, racial groups, and asked them to have their children talk about what's important to them during COVID and what's going to help them. And the number one issue was their parents. Their parents were the hero. The parent was going to keep them safe, and that was so important to them. And also, from a mental health point of view, if parents are available, can be emotionally available, I'd like to say, not just be there and listen to their children and be involved with their activities, that's going to be very important. And they will know when things are happening, sometimes before the school will know. But obviously that collaboration is very important. But parents play a key role in mental health and supporting mental health of their children.
In the Bipartisan Safer Communities Act, there are significant dollars put forward for telemental health. Does that work equally well for adolescents? Is there a role for that to be used in school health settings?
We found telemental health to be very helpful, and it does work well generally for adolescents. They kind of like that. You know, they're more used to being on the screen than others, and it is a way to stay in contact. We're very pleased that they allowed a lot of mental health work to be done using telehealth during the pandemic because it was a way that we were able to stay in touch and help people. For younger children, it can be a little bit challenging. They may want to go press a button or something like that. But we found it to be very successful in working with teenagers related to telehealth, and I hope that opportunity will continue as a way to reach them.
I keep asking questions I don't know the answer to. But hearing you speak today, it suddenly occurred to me that the people that decided to lock down our economy, who had the noble goal of limiting death, but of course ended up increasing isolation, did they actually have children's psychiatrists, psychologists involved in their deliberations to do a cost-benefit ratio, if you will, a risk-benefit ratio of if we lock down, we're going to have X amount happen because of isolation, as much as that was foreseeable? Do you know that process? I don't. I'm asking.
Yeah, I don't know for sure about that process either. Certainly, we were communicating, a number of us, and talking about it. And I recall almost every time I did an interview, I specifically recall an interview with an NPR reporter who had 2 children at home. And he took 15 minutes before he did the interview to talk to me about how can I support my children under this circumstance. They can't see their grandparents. The holiday was coming. It was a very important part of their lives. So the telecommunication was really helpful. But I'm not sure, Senator Cassidy, whether they did consult about this.
But what I'm hearing from you is actually, it wasn't an imponderable. It was actually predictable that when the children were isolated, that they would have some of the problems that we now see. Is that a fair statement?
I think it is. I think in families, it's very clear in families where they had more resources, for example, where they could work remotely, where they could get help, where they could set up separate little learning areas for a few kids, where consistent kids, they wouldn't have to be afraid of COVID. I know many families with resources who were able to do that. But for families with fewer resources, it was going to set up an ongoing problem, including learning over time and catching up, where many of these children had problems to begin with.
Lastly, when I FaceTime with my 8-year-old grandson, almost 9, he's got like 3 minutes for me, then he's gone. I say that because you're mentioning that telemental health actually works. But at the younger child, they want to hit a button. At what point does it begin to work? Because we'll be asked to support these programs in schools of various ages. At what point does it begin to work, and at what point, or is it just the little boy who's got ADD, like squirrel, squirrel, squirrel?
Yeah, I think certainly with what we call latency at children about 8 years old and older, because we found with our earlier work also that they were able to pay attention better when we did
Boys,
screening.
girls difference or the same?
Sorry?
Boy and girl gender difference?
We didn't see differences between boys and girls.
Okay.
But we found with our earlier work that age and older seemed to be going pretty well. But on the other hand, we provided mental health services to the younger children, but again, that was in person. I think it's the really little ones, because as you know, we work with very young children, like under the age of 5, that may have more difficulty with that. But again, if the parent's with them and working with them, and it's really a combination, it's not just a mental health person dealing with a 3 or 4-year-old, it's working with the parent together, dyadic work, and then the parent learns how to support the child. We're finding now in the mental health in general, even in person, but certainly virtual, that involving parents, even with teenagers, with older children, is very important as a way to support them.
Thank you.
Thank you. Senator Markey.
Thank you, Mr. Chairman. Before I begin my questions, I want to address, make a comment about the health of trans youth, reiterating some of what Senator Baldwin mentioned earlier. In the past 6 months, state legislators have passed 75 bills discriminating against LGBTQ Americans and blocking access to gender-affirming care. Drag shows have been attacked, hospitals providing gender-affirming care are receiving bomb threats, and local clinics are installing security systems. Human Rights Campaign declared a national state of emergency for LGBTQ Americans. And the discriminatory actions and statements by elected officials at every level of government are fueling the fire and making the youth mental health crisis worse. Passing bills into law is a tough process. What is easy is giving people the freedom to be themselves. What is easy is not using hate-fueled rhetoric on trans kids to score cheap political points. And we need to do this, especially during Pride Week, to identify this as a huge problem in our country. So I want to turn, to issues that obviously the Surgeon General was addressing, but you're on the front lines. 1 in 3 teenage girls contemplated suicide last year. 1 in 10 teenage girls attempted suicide last year. 1 in 5 LGBTQ youth attempted suicide last year. 1 in 5 LGBTQ youth attempted suicide last year. So this is a real crisis, and we know that it is totally exacerbated by big tech and the role that they're playing in the lives of these children in our country. Because it's just unregulated in terms of what it can do to teenagers in our society. No protections, no safeguards. They collect an avalanche of personal information and they use it up to send back an endless stream of toxic content into the minds of young people in our society. And the results are clear. More money for big tech, more pain for kids and teenagers in our country. And we know that it's Instagram. We know that it's Facebook. We know that it's TikTok. So we have to take action to pass a comprehensive law. We know that it's Disney. We know that it's Paramount. They're collecting information and sending it right back in a form that advances the financial interests of these companies. So my question to you is that Ranking Member Cassidy and I have introduced a piece of legislation that would create an online privacy bill of rights for teenagers in America. There is a law on the books right now for 12 and under, but there's no law for a 13-year-old girl with bulimia or anorexia from being targeted by these companies with information that actually worsen the situation. So here's what the legislation would do. Just love to get your comments on it. 1, the bill would ban targeted ads to children and teens. 2, it would establish a youth marketing and privacy division at the Federal Trade Commission. And three, it would limit the collection of children and teens' personal information, and it would actually say to parents, you have a right to say to the companies, erase this stuff that you've gathered about my child. Do you think that's necessary? Would you support legislation to accomplish that goal so that the parents and the kids have protections against big tech?
Well, thank you, Senator, for the background and information that you've just shared. And it is so important, I think critically, recognizing the impacts of all of this on our youth, that we're really paying close attention. I really believe hearing the voices, so having youth voices as a part of what is proposed, which is what we try to do in Connecticut, hear from all the voices, including our families, inform ultimately the impact, right, of the proposal being made. And so would really be looking at that very closely to get a sense of all that is being proposed, but anything that we can do.
But in general, do you believe that teens and children need an online privacy bill of rights in our country?
Yeah, I believe that.
Thank you. Yes, sir.
Thank you, Senator. Yes, I do. I also was struck by the comments earlier this morning, and I don't know if we're using the tools to our advantage. The data would tell us that when kids are talking about suicide, that we could inform them right there online and require companies to give them suicide information. If they're struggling with food, we could require those companies to push that information to them as well, to curb that support as well.
What about upfront, just putting the preventative action in place?
Yes,
so that the kids and the parents have a bill of rights, so that the kid isn't targeted, that exacerbates the situation, so that they do become excessively depressed and contemplate suicide. Do we need those protections put in place?
I have 3 teenagers, and I would say yes, please.
Okay, yes. And Doctor?
Yes, I would agree with my 2 other panelists here. One of the things I was thinking about, but it doesn't in any way negate what I just said, that I agree with it. We also know that for many of these youth, that's how they make relationships too. And so if there was a way that we would be able to help support them in some way at the same time that we're protecting them, I think it would be very important.
Yeah, I would say that we're in a crisis. We hear it today. We know that big tech plays a big role in creating this amongst kids. So we are urgently in need of passing comprehensive legislation. In my opinion, AI that we're discussing right now is just algorithms on steroids. But we already have algorithms on steroids by big companies who target children in our country. We have to put the protections in place. If we can't do that, we're never going to be able to deal with the consequences for AI on steroids. If we can't protect children, we're not going to be able to protect our society. Thank you, Mr. Chairman.
Thank you. Senator Brunn.
Thank you, Mr. Chairman. Senator Kennedy asked Dr. Osofsky about parents' role. I'm going to turn to Mrs. Russell Tucker. I served on a school board many years ago. Didn't have the issues, I think, that we now contend with. It's a lot different now than then. Parents were always the primary stakeholder on almost any issue. Generally, it ended up being a disciplinary one, not what we deal with currently. In your testimony, you list, in terms of on the mental health issue, the stakeholders, the Office of the Governor, and the State Board of Education, state agencies, educators, administrators, families, students, advocates, policymakers, local health officials, and more. I tried to tease out of Secretary Cardona on who the main stakeholders should be in our own kids' education, and could not get parents out of his mouth the first time. After the Virginia election, and it was made an issue there, he did begrudgingly say that parents should be a stakeholder, not the primary. So when we're talking about mental health, there's a list of a lot of, and I believe sometimes that village doesn't need to be consulted, but I would think that in any of these issues, the parents ought to be the primary and everything else ancillary. By the way you stated that, would you agree with parents being the primary, all these other ancillary, or do you have a different way of saying what you, or meaning what you said there?
Thank you, Senator. And I have longed, if you saw from my testimony, as you mentioned, recognize the value and importance of parent voice in everything that we do in education. It is really important that they are at the table, they are a stakeholder, And the family engagement roundtable that I mentioned is doing just that. As a matter of fact, they've worked together through their voices to define what family engagement means in Connecticut. And so they truly are very important. And every time we have a chance to any program, any policy, that their voices are there at the table, so we can understand, hear from them, and hear their perspectives. Because it really, so they are key stakeholders.
And are they consulted first in any navigation through a mental health issue in terms of getting with them first, or are they just part of the group?
So they, they are very much important about the health of their children. And so I know for a lot of the initiatives that we have in the state, they are consulted and provide consent for services that's been provided. And so in that case of health, I think it's very important that they are very much key and there to make decisions, help to make decisions around their children.
Thank you. Dr. Garcia, briefly on that topic.
Yes. They are very much a part of the process. At certain ages in Washington State, students can access services without family consent.
Would you say they are the primary, not just part of it?
I don't think it's a simple answer because what I have experienced is families are in different spots. And so there is a recognition that I have is that some families are not in a place where they are able to be at the table for work, social issues, a variety of things. And so as a school system, it's not a luxury of 1A, 1B.
So whenever possible and able to, you'd probably consider them the primary.
We engage them, yes.
Another question. Over the years, we've spent billions on the issue, and I'd like each panelist, we've got about a minute and a half left here. Do you think we've implemented what we've already put into law and the money that we've devoted to it properly? Do you think that's been done in a way that would justify more? Do we need to do better at that? And where does the state fit in terms of maybe being able to do that better? We'll start with Mrs. Russell Tucker. Give it about 30, 40 seconds and move on down the panel.
Really important that we're continually evaluating so we know what works. We implement, but we must know the results and the impact. And so at the state level, we've done that. You can see that in my testimony in making sure that we're indeed doing that. So we can tell you what works so we can actually talk about sustainability.
And yes or no, have the federal programs and anything we've sent your way, do you think we've implemented that as good as it needs to be?
I think there's always room for improvement.
Thank you. Dr. Garcia.
In my testimony, I asked that you work with states to require them to match your investment. My rural colleagues would let me know that categorical funding direct streams are important, and competing for grants are oftentimes problematic alone. And so I would encourage us to think about how we can do direct spends through categorical investments to build on sustainability.
No.
Yes, I believe very strongly that the investment, at least one program that I'm involved with, and that's the National Child Traumatic Stress Network, has been extremely helpful because we focus on trauma. We've been talking about trauma, how to help children, and there's also been creative ways to spread what we learn and also address the issues that we're concerned about with children. So that money's been very well spent.
Thank you.
Thank you, Senator Run. That concludes our hearing today, and I want to thank all three of our witnesses for their excellent presentations. For any senators who wish to ask additional questions, questions for the record will be due in 10 business days, June 23rd at 5 p.m. Finally, I ask unanimous consent to enter into the record 5 statements from stakeholders outlining their youth mental health priorities, and that will take place. The committee stands adjourned.